It's so good to finally talk to you. I've been wanting to do this for a while.
Oh, good.
Yeah.
I appreciate you reaching out.
Yeah, no. Um, as I understand, you have hypertrophic cardiomyopathy, or I'm just gonna
hmm
call it HCM because that is a mouthful, right?
hmm
If you want, do you want to just start off talking a little about yourself and what HCM is for anyone who might be watching?
Yeah. I just turned 39.
Mhm.
I was diagnosed at 19, 20 years old. I can't remember. It's been so long. It's about around then. So HCM is, in simple layman's term, thickening of the heart muscle.
Mhm.
Your heart muscle gets hypertrophied. So the symptoms, what happens in your heart, is it feels like it needs to work harder because the muscle's thickening more, and so it needs to pump harder, which actually creates less space for blood to flow through. So you get symptoms of shortness of breath, chest pain, palpitations. Some people are at risk for sudden death.
Yeah.
Very early on, it was ruled out for me that I was not at risk for sudden death. So that was a great thing for myself.
Yeah.
Um, some people have arrhythmia issues and need to have a pacemaker early on. I was also one of those cases that didn't. I do have one now, but early on I didn't.
Okay.
So that's just a little bit about the disease itself.
Okay.
Yeah.
And as I understand, it's a very rare disease, right? I think like the statistic is like 1 in 500 people. Yeah.
Yeah. It's
So
a pretty, you're a superstar if you have it,
yeah,
that disease.
pretty rare. Yeah. Could you just start off by describing a little about your journey through the different stages of having
Yeah,
HCM?
yeah, absolutely. So when I was first diagnosed, I was extremely young.
Yeah.
So it was definitely a lot to take in and understand. I went through a few years of just going through trial and error of medication.
Mhm.
Um, and that proved to be challenging. I was very symptomatic. The way that my body just is and metabolizes medications.
Yeah.
Um, I was very what's the word, sensitive to some of the drugs, and so I had a lot of different side effects that took me off of ones that they swore would help me and I would be good to go.
Mhm.
And early on in diagnosis, and this again was almost 20 years ago, so it was quite a long time ago
Yeah.
as far as advances in medicine and all that.
Right.
Um, and I mean, even just in the last few years, there's been such a difference in stuff with
Mhm.
HCM. So anyway, so back to then, there wasn't a lot out there. And so it was pretty much just what was in textbook and what they said, that take this medicine and you should be fine.
Yeah.
Fast forward to 3 years, it was the day before Thanksgiving, and I was told that I should probably have heart surgery, my open heart surgery,
Mhm.
to have a surgery called a septal myectomy,
Okay.
which your septal muscle in your heart between the two valves um, was thickened. So there's regular HCM, excuse me, and then there's obstructive. So hypertrophic obstructive HCM
Mhm.
or cardiomyopathy, also known as HOCM.
Okay.
So I had that. I had the obstructive kind.
Okay.
So I was told to have surgery. Fast forward some years, it was great. I went through a deep depression during or after surgery that I wasn't prepared for.
Mhm.
A lot of different changes in my body and a lot of different things, a lot of different mental health aspects of this disease that are not talked about and
Yeah.
are not shared. Um, a lot of, I wouldn't call it issues, but a lot of, um, let's just say a hard time with
Yeah.
challenges. Thank you. A lot of challenges with family members
Mhm.
because they didn't quite understand. And, there's just a lot of different things going on. So I got better, but that was happening.
Yeah.
Um, then I started to kind of go downhill again. Fast forward to 2016, I went to the Mayo Clinic, which is the top
Yeah.
HCM specialist.
Mhm.
And I was told that what I was feeling, I was too sensitive and I should just go take a depression medication.
Mhm.
So I left feeling a certain way. Fast forward to 2019. I decided, this is just I was declining. I was rapidly
Yeah.
declining, severe chest pain, and just really not being able to live life. I mean, there were times that I, had very depressed moments.
Yeah.
So moved to 2019. I was asked to be part of an advocacy group um, for a clinical trial of a medication that they're developing specifically for HCM.
Mhm.
So I joined in just thinking that I could help others.
Yeah.
And it turned out that there was a doctor who was on the advocacy board. He was in New York. I'm in California. I
Yeah.
decided to just book a trip out there to see one more time what one more doctor was going to say
Yeah.
before I decided to just call it quits and live with it.
Yeah.
And I went out there and he was like, okay, yeah, there's something going on.
Yeah.
And in 2020, at the beginning of the pandemic, in the epicenter of the pandemic, I had my second open heart surgery.
Okay.
While my family was quarantined in the hotel, I was in the hospital. It was
Little,
a
yeah.
crazy time. And fast forward 3 years now, I am the best I have felt in 20 years. I had a mechanical valve replacement, and then I had to have a pacemaker. Um, and so the disease itself is uh, a real tough one.
Yeah.
Um, she is different every day. You never know how it's gonna be. So the last 20 years have been
Yeah.
exceptionally hard and
Yeah.
challenging. So the last three have been really nice because I feel like I've gotten my life back a little. I still do have the disease and I still do have different things that come with it. I take 10 different medications a day still. I'm on diuretics daily. And I probably will be for the rest of my life.
Mhm.
But I'm,
Doing better.
yeah, I'm finally thriving with this disease
Yeah.
for
As much
for
as you
now.
can
So
thrive. Yeah.
exactly.
Yeah. So, is the chest pain still constant? Is it as bad as it used to be, or does it come and
No, yeah. So the chest pain, it's funny when it does happen now. I'm so surprised, and I'm like, what? Because it was just an everyday, all day thing. I didn't even think about it,
yeah.
and now it's so strong. Um, no, so the valve replacement really took care of a lot of that chest pain that I had. So now it'll just be typical things like I'll get palpitations every now and again,
Hmm.
different lip flutters or things. If I know pretty much where I can go to as far as exercising, and if I
Yeah.
hit a certain point that I need to kind of stop and rest, but I don't hit that point soon enough,
Hmm.
then I can maybe experience a little bit of chest pain.
Yeah.
But it previously it was all at rest.
Hmm.
Now it is caused by some action or activity. So it is
So
like I'll
check
take
the
it. Yeah.
progress. Yeah. Some sort of
Exactly.
progress, right? So,
Exactly.
so you have to limit yourself in terms of physical activity. Are there any other lifestyle modifications that you've had to make to accommodate HCM?
Yeah. So at this point I've been able to add a little bit more activity back into my life. Um, I still have to be careful with hills and I still, there's still a activity in moderation. If I do too much for a couple days in a row, then my body gets really tired and I need a lot of days of rest. I can't just keep going.
Kind of a threshold
Um,
you can't cross, right?
exactly. Yep. And sometimes I do. And then you just lay in bed a couple extra days and that's fine. You take your rest. Um, so there's that. And then the only other thing I would say um, is from getting the mechanical valve is I'm on a blood thinner, and so I have to make dietary changes, and not a ton, but there's just a lot of stuff that you can't eat and that you have to be careful of. Like for instance, if I have a salad one day, I have to make sure to have it at least two more times during that week to like balance it out. So I
Yeah.
have to be conscious and aware of like, okay, did I do that? Have I had it?
Yeah.
Different things. And I drink something that had pomegranate juice in it the other day, and she's like, "What did you have?" And you have to meet with somebody weekly.
So
She's like, "What
very
did
high
you have?"
maintenance.
It's a lot, it is a very high maintenance thing. So there's not too many changes as far as I would say accommodations
Yeah.
that are made to add to your life.
Yeah.
Um, yeah.
So throughout all your treatment and your experience, have there been any, misconceptions that you faced? Like people said it was going to be this, or and instead you actually face this, or are there some things that people just kind of don't understand about having the disease?
I think the biggest misconception is that it's not a one size fits all disease.
Yeah.
Which I don't think most diseases are, but I do think there is a standard and there is a little bit of like a checklist that you can go through that,
Yeah.
Even with some cancers that, okay, this, and this, like
Yeah.
it's a typical thing. There are symptoms that are the same, but how they happen and when they happen are all different. There is no rhyme or reason. There is
Yeah.
no full logical explanation. And that I think is the biggest misconception. And once people, and for me, physicians understand that, like this doctor did on my test, he was like, you are showing pretty severe, but if you weren't having symptoms, I would have waited 6 months and had you come back. But showing your severe symptoms plus your severe test plus your severe symptoms, let's do more testing. And most doctors just go, oh, well, you're severe, but I'm not listening to what you're saying. So we're going to just wait 6 months because this is the typical thing that we do from a textbook that told me what to do.
Right.
So that for me has been the hardest thing through this 20-year journey, is to, when you're diagnosed, regardless of what disease it is, when you're diagnosed, you put a lot of blind trust and faith in these physicians.
Yeah.
And when they don't listen to you, you're made to feel like, okay, well, should I not be saying this? Is this not real? And when you really do research and advocate for yourself, you realize, no, they just are doctors, number one, looking for a paycheck, are used to what they know. They're not, most of them don't kind of progress with change. And so, my hope is that through things like you're doing and more research and publications and through the clinical trials that are happening, that more physicians will understand, that because this is a genetic disease, it does affect genes in a different way. And so that affects the person, how they metabolize it, how their body reacts to it. So I would say that is the biggest misconception.
So just kind of dealing with ignorant doctors or ones who just aren't ready to hear what you want to say or aren't well versed in all the symptoms.
As well as on the just normal people side of it, I would say HCM falls under the category of having an invisible disease because it's not fully visible. And I parked in a handicapped spot the other day, and this man just grilled me and grilled me and grilled me and grilled me. And finally, he rode up on his bike, looked at the handicap sign, and then just looked at me and didn't say anything.
Yeah.
And I said, are you confused as to why I'm parked here? And he said, I am. Yeah. And so I explained. And so it's, that can be hard sometimes when you feel judged by people who don't know. And, I've learned it's not their fault. It's everybody has their judgments and their things. And so the best thing that I can do is explain it to them. And if they still don't understand, then that's on them.
Yeah.
But I would say that's a misconception as well as a challenge. It proves to be a challenge just because it makes you feel a little bit more isolated in the world.
It's kind of like, do you want to see my mechanical valve?
I've done so many times, do you want me to show you my scar? I will do it. Absolutely.
No, I can understand how that could be very difficult to deal with, just constant judgment and just feeling more alone and not in your body properly. Yeah.
You're trying to figure it out yourself and get comfortable in it on your own skin, in your own skin. And when you have people like that from the outside, it's just like, okay, come on, you have no idea, just chill,
You don't know what I'm going through.
I'm good now. I haven't done Disneyland. I've done an amusement park without a wheelchair, but for Disneyland, for the last 20 years, I've done it in an electric wheelchair. And the looks that I would get from people, oh my gosh, it was just crazy. And at first it really bothered me. I was really insecure about it, really sensitive. And then I was like, I tried it one time, doing it all day long at Disneyland. I was out for 4 days. My legs were so swollen. I was so miserable. You know what? I deserve this. I didn't ask for this disease. I would love to be able to walk around like everybody else, but I can't. So I'm going to do something so that I can enjoy it. And after that, I was like, I don't care what you think,
Exactly, yeah.
but it is hard. It is hard. Yeah.
So
So
that's like with outside people. Has HCM affected your relationships with like your friends and family a lot? Because I know you previously mentioned some challenges with them.
yeah, so I had this company do this mini documentary on me, and my mom called me afterwards and was just like, "Wow." And this was just from her watching it, and she has said things throughout, the course of it, but she was like, "Wow, I didn't realize the depth at what you were going through, and I'm
Yeah.
so sorry I didn't understand, and I couldn't be there in a deeper capacity." And
Yeah.
so that was really nice for me because it was very lonely.
Hmm.
You try to explain, but and I mean it really truly is, unless you've been there, you just don't
Yeah.
understand. You just can't. You can sympathize, but even the sympathy sometimes it comes at like, I want to sympathize, but I don't quite understand. And
Yeah.
like, you look fine, you look so good. I mean, and there was a period where I didn't look good. I
Hmm.
did not really look good at all. I was really unhealthy.
Yeah.
And I think they like realized it a little bit more. But even then, that was just my norm. So they got used to it. And I did a really good job at not sort of leaning into the, yeah, I feel terrible every day.
Yeah.
I faked it.
Yeah.
And I realized that was kind of hurting me because it was not allowing people to actually see me for what I was and where I was at. And so I started to, with my family, when they would ask me how I was, be like, I'm not doing good. I'm
Mhm.
not well. I'm not, right? So it still is, I don't have many things now, but it still is sometimes because I'm so much better that when I do have something, they're like, well, what do you, like,
Yeah.
you've had 2 surgeries, you're good. And it's like, no, 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 no.
Not really.
So yeah, there is a lack of understanding. And again, I don't judge anybody because I probably would be the same way. I probably wouldn't understand if I wasn't there. But that being said, um, I stayed in a relationship a little bit longer, with probably not so great of a relationship, simply because he knew my situation,
Yeah.
and it's not that he made me feel great about it, but he didn't make me feel horrible about it. So it worked.
Yeah.
It was at least some comfort that whatever.
Yeah.
But when I look back, like that really was something that I did based on my health because I didn't want to meet anybody else or have to deal and tell anybody else what I was going through
Yeah.
and feel that.
Yeah.
So I would say pretty much through the entire journey has been challenging and with that. Yeah.
Because I think a lot of people just look at the physical symptoms, how you look physically, but no one really, even I don't understand what really goes on behind here because, like, how do you feel? The mind and the body are connected, all that. So, no
I
one
mean,
really,
it's even feeling so good. I take 3 diuretics a day, and I have to plan out and time it because if I'm not near a bathroom, then it's just such pain. And
yeah,
especially post COVID, there's so many bathrooms that are locked now, and you have to be a customer and all the different things. So
yeah,
you can't just be out and about and doing it. So from the moment I wake up in the morning, I take meds, and I start figuring out, okay, if I take it this, okay, but I have therapy. So then if I do it right after,
yeah,
oh, but then I have this appointment later. Okay, so then I guess I'm just gonna have to, I'm gonna miss the morning one, and I'm just gonna have to take, I mean, and
yeah,
it's constant, all that and you would not think about it, right? Because
yeah,
I've had my surgeries, I'm perfectly great. Every time you ask me, I'm healthy, I feel great, but
yeah.
I'm still mentally thinking about it 24/7. So yeah.
So it's a very active thinking disease.
Hmm.
So
Very active thinking disease. It's a great way to put it. Yep.
I guess that's the best way I can put it. I don't know.
Yeah, no, it's
But
great. Yeah.
you think like for other people who might be going through similar things as you, I know it's not a one size fits all thing, but kind of the same symptoms. Do you have any words of advice for them?
Yeah, absolutely. Advocate for yourself and get to know your body.
Yeah.
Um, I used to be called a hypochondriac, and I will gladly take that title because, like I said, when it comes to physicians, we blindly put our faith in them. And I had some not so great experiences with physicians that caused me to lose some trust in that. And so I had to put some more trust in myself in that sense. And so I did some research and I just never gave up.
Yeah.
And I think that is a lot, the the symptoms are going to come and go. They're going to fluctuate. You're going to try different meds, and there may be a surgery, and there may be those things. But being proactive about yourself and your advocacy is the number one thing. Number two is know that the mental part of this disease is just as important as the physical. And things like meditation or yoga or even just taking walks or different things that can help kind of clear your mind. I think doing it from early on, from right at diagnosis point, not after surgery. You're not waiting till all the things, like right early on,
Yeah.
to help you kind of process through.
Right. Kind of
And
hitting the
not
ground
be,
running.
yeah. And then I think the third thing would be not holding on to any anger or resentment towards this disease. It took me 20 years to get there, and I finally am there. And it feels fantastic. Granted, I do feel in a healthy space, so that's probably why I can feel a little less anger towards it. But I do wish I didn't hold on to so much, because I think it robbed me just of so many different things throughout the years. And so I would just say, like really kind of work through
Yeah.
from getting a diagnosis on, and know that like you will be okay. The prognosis, you may need surgery, and that's something that they don't like forewarn you because they don't want to scare you, but knowing that that's there, I think makes it a little less scary. Just like,
Yeah.
look, this is the possibility for it. Let's start from step one and just be proactive in yourself and knowing who you are and advocating for yourself.
So
Yeah.
just kind of persevering through all aspects of life, you don't know how one thing is going to go. You don't know how your experience with certain physicians or family members is going to be, but you got to keep yourself up there. You got to, maintain that self-love, honestly. Just kind of,
Yeah.
yeah.
Yeah, that's
Yeah.
extremely important. And I can say I didn't have that throughout the entire journey. And my experience was rough. And I don't wish that upon anybody.
Yeah.
And there is a way to do it that, right from diagnosis, you come at it like, okay, this is what we got. Now, what are we going to do? I can choose to be angry and sad and upset, and you can still be sad, but I can also choose to thrive at life, advocate for myself, know my body, know all the different parts that come about with HCM, know why it works and what makes things work and what makes it doesn't. And when you go to your appointments, have that information, have that knowledge, so they can't take advantage of you, and they can't, and you don't just put your foot just. So yeah.
So just being proactive about it, yeah, that's really good advice. Thank you.
Yeah, absolutely.
Yeah, so I really hope people can learn about this from this interview here, and I hope that people just become more aware of what other people are going through, so we don't have like encounters everywhere like, why are you in this handicapped spot? Just
Exactly.
just getting more aware. I think that's the end goal.
Yeah,
Yeah.
I think it's amazing, and I think it's a beautiful thing that what you're trying to do, and spread awareness. We need more people to just be aware of, just being kind, no matter what people's situation is, and like you said, just having a better understanding of this disease in general. So,
Yeah.
like, I applaud you for what you're doing. I think it's awesome,
Yeah.
and thank you for asking me. I feel very honored.
Of course, yeah.